how to take coronal slices. Just to recap, you're looking at again the two cerebral hemispheres which appear symmetric. If you look at the covering arachnoid, it is very thin and transparent. You don't see any blood or any pus as in an exudate in the subarachnoid space. The vessels are again congested. I'm just shifting to the opposite side. Here you can see some subarachnoid staining. This case is from a road traffic accident. You can also see some contusions out here. So to very quickly orient you, this is the frontal pole. These two are the occipital poles. And if you look at it from the side, this is the temporal pole. So this is the sylvian fissure which separates out the frontal from the temporal. And bank center will go the central sulcus, which will separate the frontal from the parietal. In front of the central sulcus is the pre-central gyrus, which is the motor strip, and this is the post-central gyrus, which is the sensory strip. Now to separate the parietal from the occipital, you have to draw an imaginary line from this notch that you're looking at here and a slight notch here, which is the pre-occipital notch. This imaginary line will separate out the parietal from the occipital lobe. The second imaginary line that you need to draw is from the end of the sylvian fissure to this. Now this will separate out the temporal from the parietal, the temporal from the occipital. So that was just a very quick recap of the essential landmarks that you need to remember. Now, unlike the previous brain, I think it's very easy to appreciate that this brain looks a lot fuller. The gyri are more swollen and the sulci, which is the space between the gyri, are obliterate. So this is a sign of cerebral edema, and this seems to be there diffusely throughout the brain, and that's why the entire brain looks a little bulbous. You can again appreciate that there is tonsillar herniation in this case also. There is a deep groove which is separating out the tonsils from the rest of the cerebellum, and the two herniated tonsils are compressing the medulla. We should first disconnect the brainstem and cerebellum, just like we did in the previous case, by cutting through at the level of the crus cerebri. So there is evidence of uncal herniation in this case. It is more on the right side compared to the left side. Now to cut the brain in the coronal plane, the first cut will be at the level of the mammillary bodies. So that's going to be my first cut. This will divide the brain into two halves. Once you do that, each half of the brain you can now cut in serial coronal slices. It is ideal to have a thickness of about 1 to 2 centimeters. Of course, the thinner the better. So I'll start with this first. You just need to cut it serially. You can do it freehand, or you can also have equipment to help you cut it in a correct plane with uniform thickness. Let's take a quick look at each of the slices now. This is the topmost slice, and you can see these are the frontal poles, and the grey and the white matter are very clearly differentiated. There is a small contusion here in the orbitofrontal cortex. On to the next slice. This is the beginning of the corpus callosum, which is joining the two hemispheres. This is the genu of the corpus callosum, and you can see the beginning of the head of the caudate nucleus on both sides. You can see some contusion here at the junction of the grey and the white matter. The temporal poles have started at this level. Now we move on to the next slice. Here you can see a lot of contusions which are seen along the crest of the gyri, all along the This is the middle and the inferior frontal gyrus. This is the superior temporal gyrus, also showing a few contusions. But the anatomy here is very nicely seen. You can see the corpus callosum connecting the two hemispheres now. These are the lateral ventricles, and you can see the interventricular septum. Projecting into the lateral ventricles, that is the caudate nucleus. This, on both sides, are the anterior limbs of the internal capsule. Now just lateral to that, you can see beautifully the lentiform nucleus. That is the putamen, which is darker, and medially this triangular shaped structure is the globus pallidum. Again, you can see the two parts of the globus pallidum. The globus pallidum externa and interna separated by a thin white line. That's the medullary lamina. At this level, as you come down, you can also see a grayish rounded structure in the medialmost portion of the temporal lobe, and that is the amygdaloid nucleus. The next slice now, which is at the level of the mammillary body, you can see the anterior hippocampus very nicely on both sides. Along the midline, this is the thalamic nuclei, between which is the thin slit-like third ventricle. That's the corpus callosum, and on either side you can see the caudate, which has become very small now. This is the posterior limb of the internal capsule, lateral to which you have the putamen and the globus pallidum again. Now the other structures are also seen here. That's the external capsule, the claustrum, the extreme capsule, and this is the insula. Let's move on to the next slice, which is at the level of the crus cerebri. You can actually see this black line, which is the beginning of the substantia nigra. So this is the crus cerebri. As you follow it up, that's the posterior limb of the internal capsule. This whole structure in the center is the thalamus. That's the slit-like third ventricle, the corpus callosum. The grey matter just above the corpus callosum is the cingulate gyrus. Here also you can see some contusions. And now the posterior hippocampus is very beautifully seen. The small nuclear area just above that is the lateral geniculate body. This is at the level of the next slice, where you can see the corpus callosum has become very thick. This is actually the genu of the corpus callosum, which is connecting the two hemispheres. You can see the hippocampus, that's the tail of the hippocampus now on both sides. And this entire cortex now is the parieto-occipital cortex. This is the occipital horn of the lateral ventricle, and you can see the choroid plexus within it on both sides. We have now reached the occipital lobes. You can see the occipital lobe on both sides, and it is no longer connected by the corpus callosum. As we move down, all of these are the slices of the occipital lobe until we reach the occipital pole.